My name is John McKeon and I'm the founder here at Kyrie Farm in Ardclough, Kildare. So myself and my wife and family, we had lost our eldest son Kieran to suicide in 2013, and Kieran had suffered for 6 years with the first 3 years with chronic fatigue, and then that chronic fatigue was very debilitating, and that led on to chronic fatigue and anxiety and depression. It started when he was 13, so he had 6 really difficult years in his teenage years, and he had all the help that the system in Ireland could give in terms of psychiatric help. But it was very what they call biomedical focused, so it was really focused on tablets, and of course there was more than that, but that was the primary focus. And the tablets didn't work for Kieran, and he had a really difficult few years. So when Kieran died, we were left obviously in a really difficult position, and his brothers were 14 and 16 at the time. But a year after Kieran had died, I visited a place in America called Gould Farm, which is for people who have suffered serious mental health challenges and are looking to find recovery, but it's in a broader setting than the psychiatric hospital setting. It's quite a contrast. The farm, where you have the ingredients of community, meaningful participation on the farm, nature, time, and professional therapy. Those 5 ingredients are really the catalysts to healing. And for me, I was only at Gould Farm for a couple of days in 2014, but it really left a mark with me. And a few years later, I had my own sort of little crisis of what I wanted to do with the rest of my life. And I quit my job and I went to Trinity and did a psychology conversion course. And after that, Vicky and I walked the Camino, 900 kilometers of the Camino. And on it, I said, I'd love to see if we could get a Gould Farm up and running in Ireland. And Vicky agreed with me. And so we set out in 2020 to try and make that happen. Kyrie Farm is really got 2 roles to play. One is as a step down from psychiatric hospital. So when our Kieran was in psychiatric hospital and leaving it, psychiatric hospital was not the right place for him. He didn't need to be in an acute setting, which can be quite traumatic in its own right. But he also wasn't ready for coming home, because at home he was still very anxious and very depressed, and in his bedroom there was very little to occupy him. So the place that Kyrie Farm will be is that position between psychiatric hospital and home. It's a place where somebody can come out of the hospital and rebuild the sort of skills that they need for integrating into society. So those sorts of skills are social skills, having structure to their day, having meaning and purpose, which then builds hope, and seeing people who are further along on the recovery than where they're at, and that also brings hope. So one aspect is this step down from psychiatric hospital, and the second aspect is Kyrie Farm for many people could be an alternative to psychiatric hospital. In other words, coming in here instead of into the acute setting. So it will be less traumatizing and certainly less stigmatizing to come into the farm. And for some people, acute psychiatric hospital doesn't work for everybody, and Kyrie Farm won't work for everybody. But some people might prefer to come to this sort of farm and healing environment than into that more intensive psychiatric environment. So it can be a step down or as an alternative to psychiatric hospital.